We tend to think of strokes as something that happened to our kupuna, our older adults. Now, the risk of having a stroke does increase as you get older, but the reality is that anyone of any age can have a stroke. Even babies have strokes. And a troubling trend is that in the last 30 years, more and more people under the age of 49 are having strokes. So it's with this in mind that the Hawaii Stroke Coalition sponsors these two videos on stroke. Part 1 is about the signs and symptoms and prevention of stroke, and Part 2 is about the amazing work being done in the state of Hawaii on stroke treatment. So what is the Hawaii Stroke Coalition? It's a nonprofit organization made up of all of the acute hospitals in Hawaii, the Hawaii Emergency Medical Services, the Hawaii Department of Health, the American Heart Association, and other organizations. Do you know what happens during a stroke? Did you know that there are different kinds of strokes? What would you do if you thought you or someone else was having a stroke? Is it important to call the ambulance? Well, time is of the essence when you think you or someone might be having a stroke. So with that, I welcome you to Part 1 on the signs, symptoms, and prevention of strokes.
We want to ensure that patients get the same high-quality care for stroke regardless of where they are. That includes Oahu and the neighbor islands. And the Hawaii Stroke Coalition is a mechanism to make sure that patients get that great care. What it is, it's not a government agency. It's a private organization that's composed of all of the hospitals in the state and all of the EMS agencies and the Department of Health. And we work together to make sure there's a level playing field for patients. So we share best practices between those hospitals, and we advise EMS about how to transport patients for stroke and how to treat those stroke patients before they arrive at the hospital.
So 2.5 years ago, I was at the gym with my husband. We were in a class and we were doing a cardio set where we were on a cardio machine. The next thing you know, my legs collapsed on me and I ended up on the floor. Fortunately, there was an EMT, a gal who was an EMT in the class, and she had seen what had happened, and she rushed over and she was able to quickly assess me.
Recognizing stroke symptoms is very important because that begins the cascade of treatment. We use an acronym called BFAST to educate the public about signs and symptoms of stroke.
B stands for balance. Usually it's trouble with your balance, that is of sudden onset. Oftentimes you might have difficulty walking or be leaning to one side versus the other.
E is eyes, so any trouble with vision.
F for face, so if one side of the face is droopy or the other.
A is for arm weakness, so we ask patients to hold their arms out. If one arm falls or drifts downwards, that can be a sign of a stroke.
S for speech problems.
And T is for time. Time is of the essence when you think someone might be having a stroke. Don't hesitate and call 911 because stroke care begins in the ambulance.
She asked me to tell her my name. My speech was slurred, so I couldn't really tell her my name. She asked me to squeeze her hand, or if I could move my hand, and I couldn't squeeze her hand. She also asked me to push against her hand like a pedal with my foot, and I couldn't do that either. And then she asked me to smile, and part of my face was like drooped. So I could not do some of the things that she said.
A stroke is an interruption of blood flow to the brain. Blood is very important as it carries oxygen and nutrients. Our blood vessels is what moves the blood to our brain. So any interruption into our brain will cause a stroke. There are two types of stroke, an ischemic and a hemorrhagic stroke. Our ischemic strokes are those with clots and troubles with our blood vessels, with plaque and hardening of our vessels. If that clot gets dislodged and moves through the vessels, blood flow will be interrupted to our brain. If those blood vessels rupture and open, that's called a hemorrhagic stroke, and blood will end up leaking out of those vessels. So any interruption of blood flow to the brain will cause a stroke. Besides the two different types of stroke, the ischemic and hemorrhagic, there's also a TIA, or transient ischemic attack. This is a warning type of stroke, sometimes call it a smaller stroke. This also will be an ischemic stroke, but blood does regain flow to the brain and symptoms usually self-resolve, but it's still very important to go ahead and get treatment for. The last big thing I want to talk about is something we call large vessel occlusion. This is also an ischemic stroke where the clot gets dislodged into a larger vessel of the brain, causing much more disruption into the brain and almost with half of the brain dying.
Immediately when she recognized that I was having these symptoms, she called 911 and immediately an ambulance showed up.
Stroke care begins when you call 911. When we arrive, we perform our initial assessment. We'll bring you into the ambulance quickly. We'll start an IV, and we will transfer you to the most appropriate facility. On our way to the hospital, we do contact a neurologist, and they let us know what facility that they deem is the most appropriate for your care.
Time played a huge role in terms of from the time it happened to the time I got to the hospital to the time that the medical professionals intervened.
On Oahu recently we implemented telehealth. It allows EMS professionals to do their initial assessment. So when we identify stroke and stroke patients, having that neurologist involved early will help our paramedics make a decision on whether to take them to the closest facility or a facility that might have a little bit more interventions that the patient may need for stroke.
All hospitals can take care of stroke patients by giving an IV medication, but only certain hospitals in Hawaii can take care of patients that are having large strokes. Time is brain, and so you want to get the patient to the correct hospital as fast as possible.
Time is of the essence when you have a stroke because you just don't know, how quickly, somebody can intervene and, if they can stop a process from happening.
The culture here in Hawaii is everybody, when something happens at home, they want to call auntie, they want to call grandma, they want to call the brother. And what happens with that is there's a delay in calling 911. Anytime there's a delay, it might have detrimental outcomes to patient care and ultimately survivability. So we really want people, even if they're not sure, to call 911. Our ambulance crews will come out, will assess the patient, but don't hesitate to call 911. I think that's the biggest fallback we see with families, especially here in Hawaii with the culture, is not calling 911.
I'm sharing my story out there with all of you because it's really important to get the help and intervention quickly. So even if you feel shame about being pulled in an ambulance, just recognize that it's really important that those people are doing what they can to save your life so you have a better quality of life and you don't have to be impaired by some of the effects of the stroke if it's not intervened quickly.
The good news is that 80% of strokes are actually preventable. And the best way to prevent strokes is through lifestyle choices and treatment of high blood pressure.
High blood pressure is a silent killer because sometimes you don't know you have it, so you have to get your blood pressure checked. And when you know that you have high blood pressure, the best thing you can do is try to control it. You can control it through medication, weight loss, eating less salt, and we love our salt here. So please work with your doctor to get your blood pressure down.
So some things you can do to prevent a stroke include managing your diet, controlling your salt intake, managing your diabetes, getting an adequate amount of exercise, and also quit or do not start smoking or vaping.
Some other things include don't use drugs such as meth, get an ample amount of sleep every night, manage your stress levels, and maintain or get to a healthy weight. Some things that cannot be controlled include your family history, your race and ethnicity,
also your age and presence of certain genetic diseases and disorders.
A stroke can happen to anybody, but recognizing the symptoms and knowing to call 911 right away will definitely save your life, and get you into a better position. Don't hesitate to call 911.
So we just talked about Be Fast, but you don't have to have every symptom. You could just have one, and that can be a sign of a stroke.
B stands for balance. Any troubles with our balance?
E is for eyes. So if you have problems seeing, part of your vision is missing, or you have double vision.
F stands for face, and what we're talking about with the face is a drooping of one side of the face versus the other. It would look lopsided or different from how the person would normally look to you.
A stands for arm or arm weakness. So we ask patients to hold their arms out, and if one falls or drifts downward, then that can be a sign that they're having a stroke.
S for speech. So if the speech is slurred or the words are not making sense.
And T is time to call 911. Stroke care starts in the ambulance.
Early activation is very important and can lead to a life being saved.
Thank you for learning about the signs and symptoms and prevention of stroke. Take time to teach our keiki, our children and our youth, about Be Fast. The life you save might be your own. And join us for part 2 on stroke treatment in Hawaii. Mahalo. Do you know what happens during a stroke? Did you know that there are different kinds of strokes? What would you do if you thought you or someone else was having a stroke? Is it important to call the ambulance? Well, time is of the essence when you think you or someone might be having a stroke. Welcome to part 2 on stroke treatment in Hawaii.
We want to ensure that patients get the same high quality care for stroke regardless of where they are. That includes Oahu and the neighbor islands. And the Hawaii Stroke Coalition is a mechanism to make sure that patients get that great care.
The Hawaii Stroke Coalition was formed back in 2013 by the Hawaii State Senate. They were looking at evaluating what kind of stroke care we are providing across the entire state of Hawaii. Then in 2015, the legislature actually supported this officially by creating the Hawaii Stroke Coalition as a government entity. And what happens then is we got every acute care hospital in Hawaii combined with emergency medical services, various organizations such as the Department of Health, the American Heart and American Stroke Association, and all of those joined together to evaluate not only the care we provide, but what are our outcomes for the victims who suffer strokes. Well, one of the things that drove the development of the coalition itself was Hawaii's unique geography. We are the most isolated, inhabited area of the world. And as such, our islands, our multi-island spread really impacts the way we provide care for not only stroke, but for a variety of other healthcare issues. The differences across the state have to do with the absolute lack of neurology specialists, and interventional neuro providers. What happens then is we have to collaborate together in order to provide the best possible care no matter where you are across our islands.
The good news is that we have more treatments for stroke now. So time is super, super important for patients on the neighbor islands, because if they're going to be eligible for treatment, we need to know right away so we can start that system.
I was at the gym, it was a Wednesday with my husband, and we were doing cardio, and right when I was done with my exercise, I ended up feeling that my legs collapsed.
A stroke is essentially when you have a blockage of blood flow to the brain, resulting in an absence of oxygen, nutrients to brain cells, resulting in the brain cells dying.
So the first step in diagnosing a stroke is recognizing the symptoms of a stroke. So we use the acronym Be Fast.
And the B stands for balance problems. It's a sudden onset of balance and coordination or difficulty walking.
E is for eyes or sudden loss of vision.
F for face drooping.
A is for arm weakness.
S is for speech problems.
And T stands for time. Time to call 911. Because the moment you do so, you initiate a cascade of events that lead you to treatment. Treatment for stroke truly starts in the ambulance. There are things that we can do right away while you're en route to that hospital that can treat you, that can absolutely make a difference as to your return to a pre-stroke quality of life.
So pre-stroke, I was a healthy person. I worked out 5 to 6 days a week. I didn't smoke, I didn't have high blood pressure, I didn't have diabetes. So I had an ischemic stroke. I had a blood clot in my brain. At present, they call it a cryptogenic stroke, where they could not identify the known cause. I did not have any risk factors, and I was not in the age category where like most folks who have strokes are above their 60s. I was 45 when I had my stroke. So it can happen to anybody at any age.
When I think of stroke in general, I think about a stroke being, you can use the analogy of a stream in a big grassy field. If there's a blockage of the stream, then that grass can start dying.
So an ischemic stroke is when you have a blockage of blood flow to the brain that prevents oxygen and nutrients from reaching the brain cells, resulting in the brain cells dying.
In a hemorrhagic stroke, there's bleeding in the brain and the brain gets damaged permanently due to that blood.
And that's different because one is where you have an absence of blood flow to the brain, and the other is when you have actual bleeding in the brain.
The first step for treatment of a hemorrhagic stroke is decreasing the blood pressure and getting the blood pressure under control. So when someone is having an ischemic stroke, time is most important. We have an IV medication that we can give to thin someone's blood if they're having a blockage type of stroke. But that medication can only be given within 4.5 hours from the last time the patient was normal.
One of the things that we do after you get to the emergency room is we do a CAT scan of your brain. A CAT scan is like a 3D X-ray that lets us look inside your head to try to get a sense of what could be going on. And it can give us information if you have damage from not getting enough oxygen or if you have bleeding in your brain. And those things are really important to help us decide what kind of treatments might be better for you.
So we talked quite a bit about time-based treatment of stroke, but we've also said that treatment of stroke is becoming more complex and there's more tools available. One of those tools is called CT perfusion. This is actually an imaging study that measures the blood flow through the brain. And it helps us determine whether a patient is eligible for treatment. So in addition to just time, how is the blood flowing through the brain? And is it in a pattern that would be treatable with clotbuster medication? Or would it better be treated with mechanical thrombectomy, which is a procedure that sometimes patients would need to be transferred to get that procedure because it's not available at every center. That's where rapid CT perfusion comes in. It helps neurologists and emergency physicians who are treating that stroke patient determine, is the patient eligible for treatment? Do they require transfer for treatment of an LVO stroke or large vessel occlusion stroke? The good news is that that tool is one of the pieces of our tool set across the state. So the state over the last several years has invested in making sure that every hospital that's part of our system of care for stroke has access to the same tools. And one of those important tools is CT perfusion. How does CT perfusion work? CT perfusion actually directly measures the blood flow through the brain. It shows what blood vessel is blocked, and it can also show how much of the brain tissue is still salvageable. Now, what do I mean by that? If blockage of blood flow goes on for long enough, it can cause permanent damage to part of the brain. That's what we call a stroke. For all intents and purposes, that tissue is dead. And even if you restore blood flow to that tissue, it's not going to recover. On the other hand, some of the brain can just have low blood flow and be stunned, but still salvageable. What that means is that if we restore blood flow, either with clotbuster medication or the procedure to restore blood flow, then that stunned brain can recover. So CT perfusion is a very important tool to help us figure out if the patient is still eligible for treatment, if that treatment will help them, or if too much of the brain is already permanently damaged to the point where we can't safely restore blood flow. It's very crucial to get an early alert for patients who are on the neighbor islands, who might require transfer to Oahu for treatment of blockage of the major blood vessels of the brain. Because the treatment of stroke is so time dependent, telemedicine has really become a very important tool for making sure that we can treat patients very quickly after they arrive at a hospital. It's really important for hospitals that don't have a neurologist immediately available. And so we've been using video telemedicine for over a decade now in Hawaii to really speed up the treatment of stroke, regardless of where the patient is. And most of the hospitals in the state now have telemedicine services where a local neurologist, a Hawaii neurologist, is available to see them by video in that hospital, examine them, talk to them. The patient can see the neurologist can review the CAT scans and images, and then make recommendations for stroke treatment. And so rest assured that if you call 911 for stroke symptoms, that ambulance is only going to take you to a hospital that has access to a neurologist to assist in your care, either in person or by video telemedicine.
So EMS bypass, almost a year ago, we implemented telehealth medicine with EMS and stroke care in Hawaii, specifically the island of Oahu. What started out as a rural project looking at our unit out in Kahuku, where the transport times to the hospital can be quite long, especially when we're talking about stroke care and we talk about how fast care needs to happen. The goal is to keep our ambulances in their designated home area. What bypass allows us to do is when we talk to a physician or neurologist via telehealth medicine, that neurologist is able to have real video and live chat with the paramedic. They can also see the patient, and they can make a determination if that ambulance out at Kahuku is okay to transport that particular patient to Kahuku Hospital, or if that patient is better suited at Queens Hospital. Getting that patient to the right hospital to get the right treatment at the right time that's appropriate is really important. So this telehealth project and bypass, it's really beneficial to Honolulu EMS and the patient. So if we can take a patient to a closer facility and not go to a further facility like Castle or Queens, that really also benefits those communities and those patients that live in that area.
Don't hesitate to call 911.
Stroke care begins in the ambulance because we perform initial assessments, we do start IVs, we're able to give you medications as needed, and we transport you to the closest most appropriate facility. We inform the stroke team, and so they can get you in and get you your treatment as soon as possible. So paramedics are highly trained. We can perform very advanced skills, life-saving skills. So if you feel like you are having a life-threatening emergency, then you should just call us. Don't wait, because it might be too late.
So other than Oahu, pre-hospital telemedicine has recently been launched on the Big Island in North Hawaii, and hopefully soon afterwards it will be implemented across the entire island of Hawaii. And hopefully in the next couple of years, you will see pre-hospital telemedicine on our other neighbor islands as well, like Maui, Molokai, and Kauai. I think the whole idea behind pre-hospital telemedicine really emphasizes the message that we're trying to convey, that stroke care really starts on the back of the ambulance.
We've talked a lot about the ambulance and the importance of calling 911. What happens if the patients don't call 911 and instead walk in to the emergency department with stroke symptoms? The sad reality is that those patients are rarely treated for stroke. Contrast that with what happens in the ambulance. In the ambulance, the paramedics recognize a stroke, they call ahead right away. They activate the stroke team. If you don't call the ambulance and you come in by private vehicle, we're really starting from scratch after the person arrives. They go through nurse triage, the nurse has to recognize a stroke is happening, alert the stroke team, and then really start from scratch after the patient's already walked into the hospital. What that does is eat up a lot of time unnecessarily, and in many cases, patients who were treatable actually fall out of the treatment window, or they're treated very late in the course.
Time played a huge role in terms of from the time it happened to the time I got to the hospital to the time that the medical professionals intervened. Thank you. Thank you for listening to my story. I send you positive energies, and I wish you all well.
Be fast. B-E-F-A-S-T. B is for balance. Is the person suddenly having trouble standing or walking? E is for eyes. Are they suddenly having trouble with their vision? F is for face. Is their mouth drooping on one side, perhaps? A is for arm. Are they unable to keep their arm raised? And S is for speech. Has their speech suddenly become garbled or unusual? And T is for time. Time is of the essence when you think someone might be having a stroke. Don't hesitate and call 911 because stroke care begins in the ambulance. Thank you for learning about stroke treatment in Hawaii. And if you haven't already done so, I encourage you to watch part 1 about the signs and symptoms and prevention of stroke. We tend to think of strokes as something that our kupuna or older adults have. And the risk of having a stroke does increase as you get older. But the reality is that anyone of any age can have a stroke, and even babies can have strokes. One of the more troubling trends over the past 30 years has been that more and more people under the age of 49 have been having strokes.
We want to ensure that patients get the same high-quality care for stroke regardless of where they are. That includes Oahu and the neighbor islands. Because the treatment of stroke is so time-dependent, telemedicine has really become a very important tool for making sure that we can treat patients very quickly after they arrive at a hospital.
You know, on Oahu recently we implemented telehealth. It allows EMS professionals to do their initial assessment. So when we identify stroke and stroke patients, having that neurologist involved early will help our paramedics make a decision on whether to take them to the closest facility or a facility that might have a little bit more interventions that the patient may need for stroke.
You know, time is brain, and so you want to get the patient to the correct hospital as fast as possible.
Time is of the essence when you have a stroke because you just don't know, how quickly, somebody can intervene and, if they can stop a process from happening.
The good news is that we have more treatments for stroke now. So time is super, super important for patients on the neighbor islands because if they're going to be eligible for treatment, we need to know right away so we can start that system.
One way to remember some of the more common signs and symptoms of stroke is an acronym called B-FAST. B is for balance. So if all of a sudden you can't walk straight or you feel dizzy or off balance, that could be a stroke.
E stands for eyes, and what we're talking about there is a sudden change in vision, whether it be the inability to see or seeing double vision or anything that's acute and suddenly onset.
F is for face drooping. So we ask a person to smile, and then if one side of the face doesn't move, that can be a sign of a stroke.
A is arms, so any kind of weakness, arm drift in the arms.
S is for slurred speech.
T is time to call 911. Don't waste time waiting around.
Early activation is very important and can lead to a life being saved.
So we just talked about B-FAST, but you don't have to have every symptom. You can just have one, and that can be a sign of a stroke.
Teach Be Fast to our keiki, our children and youth, and remember to be fast, because the life you save might be your own. Mahalo.